Hello, I'm a level 1 nursing student. I was wondering if I could follow you today.
Yeah, absolutely. I see you're here with me with Mr. Greg Lutz, correct?
Correct.
He's a 67-year-old male. He's got type 1 diabetes. He's had it for about the last 20 years. He came to us today because he's got a right pressure ulcer on his ankle. It is stage 2 diabetic ulcer. He's been having high blood sugars since he's been with us, and we've been monitoring it with insulin checking his blood sugar every Q4 hours. He's 171.5 pounds, 5 feet 11 inches tall. He's a full code. He has no known allergies. The gentleman is up with moderate assist. His gait is relatively steady, but still make sure that you're near him when you're walking around with him. We're pending some blood urine results. He is awake, alert, orient. The gentleman has regular cardiac rhythm and heart sounds. His breath sounds are effortless. He's got clear sounds. No accessory muscle movement to breathe. The gentleman has voided 320 milliliters so far. He's got a flat abdomen, it's symmetrical and soft, no tenderness. He's got present bowel sounds in all 4 quadrants. No ascites, no bruits. Present, no feeding tube. He's got no Foley. His vital signs are normal. His temperature 98.4, heart rate at 76, oxygen saturation at 96, and blood pressure at 128/70. What else? He's been having some tingling bilaterally in his lower extremities, which is a little concerning. So there are some qualitative deficits in being able to identify sensation for him. So we want to be careful when he's walking. Make sure that doesn't progress. And besides that,
Well,
everything else is crystal.
which medicine is the client receiving, and why is they receiving this medicine?
He's receiving NPH insulin, and it's to manage his blood sugar levels.
What action does the medicine have on the body?
It lowers your blood sugar by allowing the insulin to bind to the carbohydrates in your blood system, and allows the carbohydrates or sugars to enter the cells of the tissue to feed them essentially.
When should you question administering the medicine?
You should question administering medicine if the patient's blood sugar is too low, if they're exhibiting symptoms and signs of hypoglycemia like sweating, pallor, or weakness or nausea.
Does the medicine have a therapeutic serum level?
It is not this particular medicine, no.
Which vital signs must be monitored?
You don't really need to monitor vital signs. If you had to pick one, it would be respirations, because if his respirations are very low, it could be a sign of hypoglycemia, but really you just want to monitor his blood sugar if anything.
Which physiological parameters should be monitored when the medication is being administered?
You want to make sure that you administer the medication in a fatty area of the body, so typically the abdomen, the belly, behind the arm, those kinds of areas, because it's better absorbed by the body that way. And you want to make sure that you rotate administration sites and not hit the same site over and over again.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You want to make sure that the client knows that they're asking the right questions when receiving medication. So when it comes to insulin, the client should ask questions like, what was my blood sugar level? How much insulin am I getting? Why am I getting this particular type of insulin? Stuff like that, for their own safety and to make sure that they're educated on what's going on.
What about the interventions for taking the medicine safely at home?
The client should really make sure that they're rotating injection sites, that the sites being cleaned both when they're at the hospital and when they're at home, with alcohol swabs, and to make sure that they're administering it the correct way, whether it's orally, via IV, or via injection.
What are the side effects and potential adverse reactions?
Some of the side effects can be hypoglycemia. That's really the big one when it comes to insulin. if the patient takes this medication and their blood sugar is too low, they're going to bottom themselves out, or if their blood sugar is high and they end up taking too much insulin, they can also bottom themselves out.
How will you know the medication is effective?
The medication is going to be effective when you notice that their blood sugar starts to drop shortly after administering the medication, depending on how quick acting the insulin is, which this one is a quicker acting insulin.
All right, I think that's all the questions I have.
Perfect. Let's go give him his medication.
Hello,
Hello. Can you tell me your first and last name, please?
Mr. Light Glenn.
Perfect. My name's Chris. I'm going to be your nurse today. This is my friend Tom. He's a nursing student who's been following me around. Do you mind if he sticks around while I give you your medicine?
No problem.
Okay, perfect. Now, let me see your wristband too, please. Awesome. Now, one thing I wanted to ask you was, you know how high your blood sugar was, right?
297.
Correct. And you know what that means now, right?
Insulin injection.
Correct. Now, where do you like to receive your insulin at?
Usually the back of the arm.
Back of the arm. Do you have any allergies, by the way?
No,
Okay, back of the arm. Which arm?
the right arm.
Right arm. When did they do it last?
I think it was yesterday,
Yesterday?
or maybe this morning. I think maybe it was this morning.
Not when, but where did they do it last?
Oh, my abdomen.
Your abdomen? Okay, so we can do the right arm this time. pH insulin. What did you have for breakfast today?
Some pancakes with syrup.
Oh, pancakes and syrup on a consistent carbohydrate diet, huh?
Yeah.
Sounds like a lot of sugar.
Yeah, I don't think it was sugar-free syrup.
Oh, yeah? I bet it was tasty, huh?
It's pretty good.
It's better than what I had for breakfast. You know what I had for breakfast?
Nothing.
You're right.
Basically his vital signs. What are the side effects of potential adverse reactions? Hypoglycemia.
Alright, I just need to go grab an insulin needle real quick because there are none here.
We're going to check his glucose again. Okay, going good. Okay.
Alright. Let me see your wristband, please. Good stuff. And you said no allergies, correct, sir?
No.
Alright, and one more time, can you tell me your first and last name?
Light Glenn,
My name's
Okay.
Kristen. I'm going to be your nurse.
And your date of birth.
1967.
Alright, perfect.
Kristen also. Except she's Ian on mine.
I'm gonna wipe off the top of the
How are
bottle.
you doing today?
And make sure that we've got the right medication here against the MAR. We do in pH
Okay,
insulin.
so I understand you usually
I'm going to be
do
administering 6 units, okay, because of how high your blood sugar
So what
was.
we're gonna
And
do today
that's
is,
not just, I feel like giving 6 units. That's according to the physician's orders and the sliding scale, all right?
Alright.
I'll wipe off the top. Medication's not expired. Checked against the MAR. Anything good on TV today?
check your arm, did you?
No, I haven't found anything.
Haven't found anything. Well, I hear the game's on tonight. Are you rooting for the Lightning?
Yeah,
Yeah.
hopefully they win.
I got a lot of money betting that they're going to win.
Really.
Yeah,
I mean, we'll find out.
we will.
Can I see your armband? And can you tell me your full name and date of birth?
Don't quit your job if they lose.
Okay, I won't.
Thank you so much.
So I injected
You're
6
familiar
units
with
of
the
air.
design that we're gonna give you the regular
Now I'm
insulin,
drawing
20
6 units
Um,
of
I
insulin.
gave you a little, I printed out an information sheet for you just in case. I know you understand it because you've been taking your while, correct? Yes. Okay. So you know, basically.
Good.
The
A one-handed
side
recap.
effects of low blood sugar or high blood sugar, but this is just something you can look at when you take it home with you or. while you're
Alright, you
doing
said
it.
back in the right arm, correct?
Correct.
You have any questions for me?
Wipe it off with alcohol.
This moment? Okay.
Good. Try and let the alcohol dry just a little bit so it doesn't burn the patient. Alright, we're going to pinch, going at 90 degrees. Good. How's that feel?
Good.
Do you have any pain at this time?
No.
No? Alright, now I noticed you were asking your previous nurse earlier about having some education on your consistent carbohydrate diet and some ways that you can prevent further diabetic ulcers from happening. So I went ahead and I printed out some information for you regarding both those two topics. Really, with a consistent carbohydrate diet, you just want to make sure you're not eating too much carbs because that's what turns into sugar in the bloodstream. And when it comes to diabetic ulcers, you want to make sure that you're getting adequate blood flow to parts of the body that are being put pressure on. If you're not getting adequate blood flow to that part of the body, you don't want too much pressure to be put on it, okay?
All right.
Do you have any other questions?
I think that's it.
All right. Well, it was nice meeting you. I'll come check on you in a little bit and see how you're doing, okay?
All right.
All right.
All right. Were there any pertinent pieces of information you reviewed before administering the client the medicine?
Whether or not the client refuses the medicine is a pretty pertinent piece of information because they are allowed to refuse the medication. What his blood sugar levels were, because again, you don't want to administer insulin to someone whose blood sugar is too low. I checked the sliding scale to make sure that the amount of insulin that I was giving was correct per the sliding scale, and I made sure that I didn't administer the medication in the same spot as he received it last time.
Did this information affect your decision to administer the medicine?
It did, because if the patient's blood sugar was too low, I wouldn't have administered it, and if the sliding scale had some outlandish, ludicrous number value for the number of units to give, I would have double checked with the physician. So for example, if it said, okay, if his blood sugar is 290, administer 10 units of insulin, or not 10 units, but more like 30 units of insulin, then I would have contacted the physician and asked if that was correct. So yeah.
Did this information affect how you administered the medicine?
Yes, because he wanted, the information said to administer the medication via IV, or via injection, so that's what I did. 6 units, that's what I did. And because I knew that he had gotten it in his abdomen beforehand, I injected it in the back of his arm instead this time.
All right. I think that's it. Thank you for letting me observe you.